Maureen Hollocker. I'm from the Children's Trust Fund Alliance. You are joining the Strengthening Families Networking webinar for today, September 12th, 2004. These webinars are offered on a monthly basis from the Strengthening Families Initiative from CSSP, Center for the Study of Social Policy, and the Children's Trust Fund Alliance. Cailin, my partner in these webinars, is here today. So these webinars, if this is the first time you are joining, they're an open invitation for anyone who uses the Protective Factors framework and coordinates strengthening families' efforts within their community or state. It is jointly convened by CSSP and the Alliance. Topics and guest speakers are coordinated by CSSP and the Alliance, and volunteers and suggestions are always welcome. We have plenty of slots coming up in the future, so if you have an idea of what you would like to hear about, or you have something that you would like to offer as a presentation, please let us know. Recordings and materials from years and years of past webinars are posted at the link that you see there, and we will also put that in the chat box. So if you want to look at past webinars, that's where you can find them. Upcoming webinars, it is the second Thursday of each month, Eastern Time, 3 o'clock. October 10th, we're going to offer a Strengthening Families 101, and we have registration open for that. November 14th is going to be a manifesto for race equity and parent leadership in early childhood systems and release of the Manifesto 2.0. You can subscribe to CSSP's Strengthening Families newsletter to get webinar announcement and other news. So you can just visit the website or the link that's offered in the chat box. So our plan for today, I'm very happy to have my Alliance team with me here today. We are going to discuss what parents are saying about changing mandated reporting. So with us today, we have Meryl Levine, the National Director of Parent Partnerships with the Children's Trust Fund Alliance, Jim McKay, the National Public Policy Director, and Dee Bonnick, National Parent Consultant and Alliance Birth Parent National Network member. So I'm so pleased to have you all with us today. Again, Cailin O'Connor and myself are here in the background, and we will get started, and I will hand it over to you, Meryl, if you're starting.
I am. And good afternoon, everyone. I am, as Maureen indicated, Meryl Levine, National Director of Parent Partnerships with the Children's Trust Fund Alliance. And I'm excited to have Jim McKay, our Policy Director, and Dee Bonnick with me, joining me today to introduce a new publication in our What Parents Say About series that we do in partnership with parents. So happy to be with you all today and looking forward to sharing a little bit more about the publication and hoping you'll join in thinking around making some reforms around this particular topic. So with the next slide, I'd like to just, I think most of you are aware, but just kind of wanted to introduce what the Children's Trust Fund is in terms of being the 34-year-old membership organization that supports children's trust funds nationwide. I know that many of you know we are a national leader in developing and investing in lots of strategies and policies and best practices that strengthen families and prevent child abuse and neglect. We partner with parents in all of the work that we do. We have a multitude of networks that we work with in terms of supporting parents and helping to work with them in developing policies and practices that will really effectively respond to the needs of families and communities all across the country. We train service providers and parents on building protective factors using our nationally renowned curriculum, Building Protective Factors. And I know many of you are very familiar with that as well. So today, what we want to do, if you go to the next slide, is we want to talk more about introducing this publication to you, discussing some of the challenges related to the whole mandated reporting process, talking about how to reduce the numbers of reports that may be made into the child welfare systems, highlighting some of the ways that we can make some of these kinds of changes, and really engaging in a conversation with all of you that are here today around what you might be able to do in your own communities and states to help in terms of making some improvements in the reporting policies and practices. So with that, on the next slide, I just wanted you to see what the actual publication itself looks like. Jim, I believe, has put into the chat box the link where you can download the actual publication itself. Dee is with us today in terms of really talking specifically around how so important it is to engage parents in all the work that we do. And parents were very, very entrenched in terms of helping us develop this publication. And you'll see all throughout quotes that are made from parents as well as professionals in terms of the need to really make some major reforms in this particular area. If we go to the next slide, let's just take quickly a look at some of the statistics around mandated reporting. As many of you know, the laws themselves were put in place primarily for professionals and community stakeholders who work with children and families to really make reports of suspected child abuse and neglect if it were appropriate to government authorities. One of the things that has happened is, though, the mandated reporting requirements themselves have really greatly expanded over the last 40 years. And today, really the number of reports that are made is really pretty staggering. If you see right here in 2021, this is 2021, child abuse hotlines received approximately 3,900,000 referrals of alleged maltreatment. About 1 in 7 of those reports were confirmed by Child Protective Services as cases of maltreatment. So that is 15.4%. That's a real small percentage compared to the amount of reports that were made. Nationally, more than 1 in 3, or 37.4%, of all children will be subjected to a report prior to their 18th birthday. And the numbers are even higher for Black families, with 53% of Black families being subjected to a CPS investigation prior to their child's 18th birthday. So as you can see, the vast majority, even though these reports are made, a lot of them may not be substantiated. Let's go to the next slide. And just to introduce you to some of the challenges, what really is happening across the country and what we're hearing in terms of talking with parents, what we hear is that parents who really actually need some types of community resources and supports to address needs within their families are really fearful about seeking services because of the fear of being reported to the investigative bodies. That's really an important piece of information to take in today, because as we move forward, we really want to look at what might be able to be done to address that kind of an issue. Child Protective Services, the systems themselves, they're really overwhelmed due to a great many of the reports actually being related to poverty and not even being really appropriate reports to make to the government authorities. If we look at just a research study on the next slide, it was done by a researcher, Raz, in 2020. What you're really seeing here is that more mandated reports that are made are not necessarily linked to better detection of maltreatment, nor are they linked to better outcomes. That's pretty significant when you look at those kinds of findings. Policies and the training that is being done today focus primarily on increasing the numbers of reports, but not necessarily improving what is being reported in terms of the accuracy or the types of strategies to help reduce reports that really shouldn't be made. Low rates of substantiation of allegations indicate that over-reporting really is happening all across the country. People are tending to use moral judgments when deciding to report, and the reporting in many instances really can be used as a form of surveillance of families, and it is a significant cause of racial disparities. With that, I'm going to turn it over to Dee and let her continue on to kind of talk a little bit more about some of these findings.
Thanks, Meryl. And as Meryl said, that there is this overrepresentation of putting parents into unnecessary situations and contacts with Child Protective Services. And I think a lot of times there's not an understanding of just how harmful that can be and how traumatizing that can be. And what we have heard from parents time and time again is that is the exact case that happens, is that they are traumatized. They are seen in ways that are less than humane and treated in ways that are less than humane. And this parent here spoke a little bit about this. In this quote here, it reads, "When reports are made to Child Protective Services, we are subjecting families to experience the worst and sometimes the most traumatic events of their lives. If services for parents are more easily accessible without court or child protective service intervention, then parents could access the resources they need to make informed and healthy decisions about the direction of their families and their growth." And that is something that we had heard time and time again on a participatory action research project that I was a part of in 2022. So if we could advance to the next slide, I'll tell you a little bit more about that research project that I was a part of, as well as 9 other parent leaders. So back in 2022, the Children's Trust Fund Alliance was asked by several foundations to identify parents who could engage in a participatory action research project that explored the front end of the child welfare system. The Alliance identified 10 parents with high levels of expertise gained through their own lived experience to work in partnership to design and implement the research study. Those 10, which included myself, conducted interviews of 100 parents across the country. And what I want to reiterate on this particular piece is that there was 5 of us that were a part of the core team that what actually helped to design this entire process, this entire research process. And it's very important that we just don't have family voice, but that, in parts of things, but also we want to make sure that we're a part of creation at the very beginning. So we want to be able to co-create, co-design. And this participatory research process really had us at the very beginning making decisions. And I think what it did overall, and Meryl was a part of this, and Teresa as well, it really gave us a high level way of really thinking about how in which we respect the process of doing things. And the process, to me, is just as important to any type of outcome. And so it was really important that we had this process that really respected and had reverence to the voices of the families that we were going to be interviewing. And so that intentionality and that respect and that reverence was there in every interaction that we had. And that to me stood out. And I'm on a bunch of projects and a bunch of initiatives and a bunch of different things. But for me, this initiative really stood out because it did really give us an opportunity to really think about the ways in which we authentically incorporate the family parent voice into the process, which is co-creating, co-designing, making decisions together. And that was something that I appreciated a whole lot. But some of what we did in terms, some of the themes that we heard from parents, which probably will not be a surprise to anybody on this call, but most parents who participated in these interviews recall that CPS investigations was difficult and a dehumanizing experience, that social workers or workers lacked empathy, care, or concern about their families. Parents were very aware that child welfare could take their children at any given time, and that fear was a common theme. Parents shared that they were rarely given any resources to prevent removal. Black and brown families also felt that they had experienced harsher treatment within the system, and their outcomes were harsher. Some of the recommendations that came from this study was social workers would try to make greater efforts to understand the families and their circumstances, expand the training of social workers on topics related to like trauma and parental engagement and partnership, cultural competencies, mental health and substance misuse, more access to preventative services in the community, create parent advisory boards to inform policies and process improvements, also parent mentoring programs so that they don't have to go through a system that they know nothing about, that they're traumatized about. If they had parent mentorships, that would be helpful. There was also a need for parents to understand what their rights were. We heard that a lot. They didn't even know what their rights were, and they didn't understand what the process was because no one explained it to them, which is also, on top of the trauma, that is also traumatizing, not knowing what's going to happen next. And as you can see, the Alliance centered, again, they centered not just centered the voices, but they centered the skills, the expertise, the experiences of parents throughout this study. So in addition to the parents' feedback from the study, many parents from the Alliance Birth Parent National Network that I'm a member of and other parent advisory groups shared that they wanted to make changes of mandated reporting policies and practices. So as we advance to the next slide, it's really important to have that parent voice represented because oftentimes, even with the good intentions of agency staff, other community partners, other different agencies being involved, sometimes what we do is just have different language or tweak things around the edges, but we end up with the status quo. And making sure that we have parents in the room to help us kind of think these things through and process these things through gives us just a fresher lens, or I think a more broader lens in terms of how we actually want to be able to really have the changes that we want to see in mandated reporting. Or like some of us want to change it from reporting to supporting. And so, we understand that many families never got connected to any services anyway. And so some of the additional changes and the benefits of the changes would be additional guidance around situations requiring CPS interventions, information and access to alternative community resources, training, new training and coaching around mandated reporting. And that also would mean having parents co-facilitate those trainings. It's really important for us to model that. And also I think mandated reporters don't often understand what's on the other side of making that report. They don't understand the harm that it causes, the trauma that parents and children have to deal with. And so I think making sure that we have the understanding that when we're making these reports, that there is harm that is caused, and that should be the absolute last resort if it is something that is warranted. Because I think, like Meryl was saying, we have been conflating poverty with neglect, and and again, we haven't allowed the community to really do its due diligence to support families. So as we advance to the next slide, I am going to turn it over to Jim, because he will really be talking a little bit more broadly and more in depth about some, promising practices that have happened across the country with communities being responsive to trying to figure out what the changes that could be made around mandated reporting and supporting practices and policies. So I'll turn it over to you, Jim.
Thanks, Dee. Thanks, Meryl. Thanks everybody for being here. We're excited about this publication. There's been a lot of discussion around the role of mandated reporting, particularly during the pandemic, and its understanding as schools closed, people started to reflect what's the role of mandated reporters and surveillance. And as Meryl pointed out, and the issue brief highlights, the research shows that children are not really safer in places that have stronger mandated reporter requirements than other states. It doesn't particularly help to prevent harm to children, and there are some consequences that come from unwarranted reports, inaccurate reports, and so forth. So a lot of different places around the country are revisiting the role of mandated reporting, the role of surveillance of families, and shifting to support and uplifting connection, building protective factors, which we're excited about as strengthening families framework. So for this publication, and really we start to ask the question, how do we make this shift? Who better to inform us on what that shift should be and what would be effective, but to ask parents themselves. And so through the Birth Parent National Network, and really want to uplift the work of other parents. Joyce McMillan and JMAC for Families has done a huge amount of work in this space to shift the dialogue, to talk about the need to shift from surveillance of families, policing of families, to more support, but recognizing it is hard to do, that folks are often making these reports, not necessarily maliciously, but they don't have the tools to maybe understand what the role of Child Protective Services is and how they connect families. So we're excited about this publication. We think it's important to share with key stakeholders that you may be working with, to recognize the harm that families experience from an unnecessary Child Protective Services report a lot of times. And I'm guilty of this myself. Traditionally, when we've done mandated reporter training, it has been so focused on, if you see something, say something, when in doubt, go ahead and make that report. And so we've over calibrated to report for all sorts of situations. And oftentimes those reports are driven by bias and misunderstanding, not recognizing that a Child Protective Service report, even if it's found unsubstantiated, can have a very negative consequence on families. And so want to talk about that. How do we improve mandated reporting practices, child welfare laws, policies, shifting the focus of our systems towards support of families, and changing this system ultimately so that we are helping families access community resources. We can go ahead to the next slide. And on this slide, we talk, and this is in the issue brief, the role of child well-being. And there tends to be, when you ask the public at large or educators, others, like, I want to prevent child abuse, I want to help families thrive. Oftentimes they tend to think, well, I call Child Protective Services, and that is the role. But the reality is that when we're talking about promoting child well-being, it's all of us as a community who are supporting families, helping those families who may be at risk through supports like family resource centers, child care providers, other family support programs that help families build those protective factors. And then ultimately, we do know that child abuse is real. Unfortunately, too many children face harm through child sexual abuse, other forms of physical abuse. And so if they're unsafe, that's the role of Child Protective Services. But often we've got one phone number that folks call in all cases. We use the comparison sometimes of a lifeguard, and that sometimes we'll call the lifeguard when a child is drowning, but we don't need to call the lifeguard for every time a child is splashing. We can deal with that in other ways. Or when do we call the fire department versus when do we take care of something as a family in our own home? And so we've over calibrated as a system towards CPS and calling CPS, and then that has harm, which we'll talk about. So instead, when we're talking about supporting families, really the guiding principles we want to use are the protective factors. We'll go ahead to the next slide. When we talk about the role of community members, it ultimately does go to building the protective factors, the 5 protective factors. Folks on this call, and I'm excited you'll have the 101. If you're new to protective factors and strengthening families, sign up for that October webinar, really dig deeper. Excited about the new research, the updated research that Cailin and Charlene have done, particularly around parental resilience and recognizing the role that parental resilience has. And it's not just an individual thing that we either have or don't have, but it's facilitated by relationships, by community and societal factors, so that when we're faced with stressors, we can help mitigate that. And that's oftentimes what we're talking about in this role, that there's stress on a family is under some kind of struggle. Someone who cares about children well-being notes that the family is struggling, but they often default to calling Child Protective Services, which brings in somewhat of an adversarial and does not connect the family to support. So we need to work and understand the role of protective factors, how all of us have a role to play. We'll go ahead to the next slide. So as we go through the continuum and getting down then more towards the Child Protective Services system, we also want to narrow that door of child welfare so that it's not just sweeping so many folks in. In particular, we know there are real harm caused disproportionality, particularly of Black families, families under poverty that are getting swept into the child welfare system and foster care disproportionately. More likely to be reported to CPS, more likely to be substantiated, more likely to have family separation and child put into foster care, termination of parental rights. All of those disproportionalities often stem from that initial call driven by bias that can then have a harmful impact. So we need to then make sure there's checks and balances narrowing this front door of child welfare. So some of the concerns we have is that states don't provide specific details on how you distinguish poverty from neglect. How do you mitigate those unnecessary, inaccurate reports? We have a system where CPS ends up investing in all of the reports instead of the ones they really need to focus in on, where the child is unsafe. And it's really, we need to remind ourselves that we, again, as a community, educators, neighbors, all of us have this role to play to be promoting child well-being. Go ahead to the next slide. One of the things we heard over and over through the research and one of the calls to action is this understanding that mandatory reporting is not neutral. There are real harms that can be caused. I'm sure with the number of people we have on this call, people on this call have likely been faced with a report. That's not a good day. That's not a good day when you're having to answer those questions and so forth. So some of the things that the research tells us that we highlight in the issue brief, CPS involvement can have a domino effect. It can ultimately lead to eviction, job loss, your impact on citizenship status. Just imagine and just kind of think of it in real life. You're working a retail job, you get a call that Child Protective Services has interviewed your child because there was a report that they didn't have a coat, or they said something that triggered this call. So you have to tell your boss, I'm sorry, I need to go to the school. Well, why do you have to go to the school? Well, Child Protective Services has got a report. Or maybe the report's about something going on in your home related to domestic violence. You're already a survivor of that, having to mitigate all that. And next thing you know, your boss is not understanding, takes you off the schedule, you lose your job, or you lose your affordable housing. All these things can have real impact. Certainly citizenship status, documentation, undocumented folks, these intersections with systems can have a real harmful effect on their ability then to be the parent they need to be and support their children. Once the CPS comes and asks a question, the visit can be traumatizing. You know, we often tell our children, don't talk to strangers, but then this stranger comes in and they've got a CPS badge and you have to tell them everything. And if you don't tell them everything, it's held against you. And that's so there's a lot going on in this space about knowing your rights and understanding that. So a lot in that space that's kind of reform that's going on. And then lastly, and probably most importantly, the call to CPS does not connect the family who has needs with supports. And it's not really designed to do so. That's not the role of Child Protective Services. Child Protective Services is about child safety, child protection. It's not a family support program. And so, you know, the previous slide, I had the protective factors on there. When we often teach the protective factor, we talk about what makes your family strong. I have yet to hear someone say CPS makes my family strong, or surveillance or a call to CPS makes my family strong. It just doesn't build a protective factor. Its role is different. It can save a life if necessary. If a child is being brutalized and harmed, there's a role for CPS, but the general sweeping, you know, again, 37% of all families and only 1 in 7 is substantiated. So what about those other 6 families? And so that's where we need to offer supports. And so we're excited about some of the promising practices that are emerging across the country. We'll go ahead to the next slide and I want to share some of the tools. So we talked a little bit about kind of what the research has, the need for action. Just want to share a few things that are out there. Again, most of all, I would recommend, and I think we would recommend, talk to parents because they're going to give you the best information about what works. But some of the folks who are talking to parents and designing these tools, this one that's on screen right now is from New York State. Bernie Pratt with the Children's Trust Fund there. They worked with a lot of key parent leaders who have been active in the New York advocacy area. This is their updated mandated reporter decision tree. And so it walks through whether or not I need to make a report. So I'm not just making this knee-jerk reaction. And then secondly, they're assessing for bias. We know that bias is really key. It has not traditionally been part of our mandated reporter trainings, but it needs to be part of any type of training that we're doing where we're informing people about what they need to do to make a report on someone, because it's going to be driven by a bias. Bias is in how our brains work. We make quick decisions without even thinking about them. It's part of how our brains work. So we need to know that that bias is there and take action to mitigate that. So we can go to the next slide and see a little bit clearer. One of the questions, and again, New York, great credit to them for asking this question. I'm happy to get that decision tree link in the chat. Once Dee comes back, I'll pull that up and send that around. We'll make sure it's out in the handouts as well. So assessing for bias, just a simple question. Okay, I've got a child, I've got concern about their well-being. I think I might need to make this report to the hotline. Ask myself, would I make the same decision to call if any of the following is different? If it's a different race, if it was different sexual orientation, if it was a different gender, I'm calling because it's a single father versus a single mother, the neighborhood they live in, their socioeconomic status, immigration status, all of these things. And if you would make a different decision, if something was different, one of these characteristics was different, then bias may be driving your decision. So taking a step back. And one of the key factors that we can do to fight this is have a conversation with someone else. You don't have to make this decision on your own. You can have conversations with other people so that you can check that bias. But bias is very real. It's driving a lot of the harm that is caused. So we need to assess for our bias. And there's different resources out there. Again, on the we'll send the decision tree, which has links to assess your own bias from the Harvard implicit bias test and so forth. Some other
Jim,
yes.
this is Meryl. I just wanted to add to that when you're talking about Also the whole piece about making a different decision. A lot of reforms are happening where they're building in like another set of people in an organization that you can check with and talk about before you make the decision to make the report itself. Or, you know, so they're building in some new different ways so that a report doesn't necessarily have to be made. Like you can call a different warm line and talk to staff and say, does this look like an appropriate kind of call that I need to make, instead of immediately making the report, so that they can check with somebody first. So I just want to let you know that that's out there as well.
Thank you, Meryl. Absolutely. And we can go ahead to the next slide, which shares some of that as well. So California has done some of that and making those resources there. I think I found the decision-making tree is, I believe, at that link that I just popped in the chat. So California, some of their reforms that they have done, passing a law 2 years ago, prohibiting reporting to CPS only for poverty-related reasons. Many states have this distinction that child neglect shall not be considered neglect if it's due to economic challenges on behalf of the family. We're seeing movement at the federal level on that. The Title 4B, which is a major child welfare reform guidance, the markup of that bill by the House Republican Ways and Means Committee, chaired by Jason Smith from Missouri, very conservative policymaker. They included enactment of legislation that would clarify that poverty is not neglect and no child should be separated from their family solely for poverty. That bill has not been fully enacted into law, but it's showing that this interest as that moves forward. Other California examples, the coalition in Los Angeles County, looking at trends for hotline calls, revising their training curriculum. We're seeing that in multiple places. Just shifting this discussion. What if we were mandated supporters instead of mandated reporters? And how do we build these connections to community-based services? Minnesota, technical assistance, helping local organizations reduce those disparities. Texas eliminated anonymous reports, which is often a problematic. Typically we had been like, well, you need to make the report, but when you're anonymous, it can have some problems associated with it. There can be some manipulation, sometimes malicious manipulation of the reporting process, and just some concerns with that. So that's another promising move. The tool, go ahead to the next slide here, from Los Angeles County. It's similar to what, oh, I see. Just got a note about the bias tool. I'll circle back to that. The tool, I think this one is what, Meryl, do you want to add a little bit more on this? I think you've more.
Yeah, it's similar to the family tree type of tool that you were just mentioning in New York. They're really trying to help people make the decision whether this is an appropriate kind of reason to make a report or not, or to look at if the kinds of needs that are identified from the family, they could refer them back into the community and get the resources that they need within the community. But it's a very similar kind of tool of assessing so that you can determine whether it's an appropriate need or not. The other piece of what they're looking at is they're adding a navigator who is really helping in terms of linking families to community-based prevention resources in that process as well. So they're doing two, to me, pretty innovative kinds of ways of trying to reduce down the numbers of reports that may not be appropriate to be there.
Awesome. Thank you, Meryl. I do see the question in the Q&A. Has the assessing for bias tool been validated? Yes, it's actually part of the Harvard implicit bias work. I'll find the link and put it in the chat here shortly. There's multiple types of assessments, including bias, racial bias, age, weight, religious bias, and so forth. And so it's just important to kind of know where our biases are. We all have them. It's how our brains work. but the knowledge then helps us make different decisions and making sure we're acting on facts versus our bias. Go ahead to the next slide. One of our quotes that we had shared is from families is again is that we need this training and ultimately how to connect families to the supports that they have. So I just butchered that quote. My apologies. But ultimately, it's not just about the training, but it's about practice. And so, again, when we've talked with mandated reporters, they generally are trying to do the best thing, but they don't know what other options are there. They're concerned. Well, this is the information I've had. If I have concern about the well-being of a child, I call this number. And then it somewhat just kind of like they're off the hook. And so ultimately we need to have partnership and working with families because, and we've seen this even with the American Federation of Teachers, they have a full-blown training on being a mandated supporter instead of mandated reporter to buffer this understanding so that they have that teachers don't report a family and then undermine the trust they have with that child and the family forever based on this report that was made out of concern for the well-being of a child. So instead, how can we build the tools so that so educators know how to make a report, but also how to offer support? We'll go ahead to the next slide and talk about some of that work. Thanks, Steve, for the tool there. So I want to give a shout out. I don't know if she's on. She's on a lot of these calls. Claire Luge from Arizona, Prevent Child Abuse Arizona, was the first to kind of announce and do an initiative called Lean on Me Arizona. We copied it. I live in West Virginia. We copied it in West Virginia, New Jersey, Kentucky. Other states are looking at this, but it's trying to connect families to supports rather than have this over reporting. So go ahead to the next slide. I'll kind of overview what Lean on Me stands for. And again, it grew out of partnership with families. So Claire in Arizona, other states that have modeled this, we have focus groups with community members, stakeholders, particularly families. And we said, what would help offer support? And what's a role for mandated reporters, community members who care about children to connect to families on a term in a way that values families and is in partnership with families rather than this adversarial relationship that we too often see or something else. So it's working really in true partnership. And so Lean on Me is an acronym. It stands for listening, empathy, affirmation, and non-judgment. And we're training community members around the states around how to do this, how to have conversational on-ramps with families, to ask them tough questions. I've noticed this is going on. Can you tell me more? Let's get you some support. How can we make that happen? How can we have a warm handoff? These concrete supports that we know are a protective factor, but how do we help those people who are with families have the skills, the social work, the home visiting, that rapport to be able to have these difficult conversations? Again, listening, families know what they need best. Empathy, we all need help sometimes. Then how do we have empathy for one another? Affirming an affirmation, what's strong versus what's wrong, and ultimately non-judgment, that we all need help sometimes. Families deserve dignity and respect no matter what. A lot of families are struggling under the weight of poverty, of structural racism and oppression, and so we all need help. And so how do we help one another and come together as community members? So we're excited about Lean on Me. I think there may have even been a Strengthening Families webinar on that topic that Claire and others. So happy to share more information about that approach. Another one we really like is from Florida. Next slide, thank you. Is called the PAUSE framework. We always love an acronym, right? We got 5 protective factors. We got Lean on Me. Now we got PAUSE, just in case you were losing track. But PAUSE, just a kind of a step back. And so the first moment is for us to really literally pause when we are faced with a child and we see this concern. We've seen through different trainings the messy house picture, and how do we assess what's going on? What are the risks in here? Whether we're doing the HOPE training or other family support trainings, you'll often see these kind of illustrations of a messy house, and how do you then take a step back and assess for strengths and connections? We need to do that same thing when we're faced with the situation. Okay, oh my gosh, this child has said something that gives me real concern about their well-being. Let's take a moment, take some breaths, get to our downstairs brain, and not react just impulsively. So pause, analyze what's the information, what are the facts that give me a reason to believe this child has been maltreated, and identify them specifically, write them down, use our big brains for a reason, analyze the situation. U is for understand. Have we communicated to understand the circumstances, gather adequate information about their current situation, separate facts from assumptions? We tend to jump to conclusions. That's where bias can really trip us up. So making sure we have that understanding, self-reflection, S for self-reflect. Do we have bias? Is my decision being driven by bias? Would I make the same decision if this person lived in a different neighborhood, if they had a different ethnicity, if they were a different age? And then deciding, E is for extend, support, and or report. You do not have to report a child to support a child. You can do both even. And so involving families together. And so engaging, extending support. Sometimes you may need to make a report. I hate that child abuse is real, but it is. And so we need to be able to protect the children, but oftentimes when we're over reporting, unwarranted reportings, inaccurate reports can overwhelm our system, and it then can further harm children because the family that needs help and is really struggling is afraid to tell you what's really going on, afraid to sign up for a home visiting program or come to a Circle of Parents program because they think, if you know my business, I'm gonna lose my child. Every time I've asked for help in the past, it's come with consequences. So I'm just going to try to get by on my own. And so when we have that culture so pervasive, it really leads to children being in more harmful situations. So this really is about extending support to connect each other. And so then determine, am I legally required to make a report or not? There's a lot of move to shift away from mandated reporting. The suggestion that one person made, though, is we don't have mandated reporting for fires, but we still know when we need to call the fire department. So there's ongoing discussions about what's the role of mandated reporting. And so we hope that this study, this issue brief from parents can be a call to action. And I'm going to let Dee talk a little bit more about what we hope to achieve with the issue brief. Thanks.
Thanks, Jim. I'm going to be really, really brief in the interest of time. So there is a call to action that parents want you to know and want you to think about. So when it comes to mandated, we want to shift it from mandated reporting to really supporting families. And so review your mandated reporting laws and your practices and consider actions taken to reduce the entry of low-income families, as well as Indigenous, Black, Native American, and Latinx families, including being included into the child welfare system. Encourage your state to narrow that front door of child protective services, revising the laws and regulations that are fear-based and that penalizes families, expand availability to community resources for families, such as warm lines, parent mentoring programs, housing, food, cash assistance, support groups, create community advisory groups that includes parents, caregivers, and other stakeholders to inform policymakers and community leaders about the needed improvements around mandated reporting policies and processes, develop and promote new messaging that helps professionals reduce reporting to CPS, and also, last but not least, dig deep into this issue brief that we just presented to you today, as well as the other resources that will help guide you in your thinking around some of the revisions that you would like to see and the changes you would like to see around mandated reporting into supporting. And I think, am I turning it over to, oh, yeah, and of course, I was like, am I turning it over? I'm like rushing because we're running out of time. But leaving you all with this last quote from a parent. about their concerns with mandated reporting is that it largely absolves the community of any sense of duty to help, to teach. We teach and ingrain the need to report, but not to support. Right now, we have that opportunity to strengthen, support, develop, and delivered by communities themselves. And that was from a parent, part of BPNN. So with that, I don't know if I'm passing it over to Meryl or Cailin.
I know we have very limited time, Dee, and just wanted to open it up for questions, if there were any questions at this point. I know, Cailin, we didn't leave very much time here, so I don't know whether you want to go on with your announcements, but we are certainly.
I did see one question in the chat. Someone asked about training for mandated reporters who are required to report legally in their states right now, and whether there's any shifts happening so that they are not responsible in the event of overlooked child abuse. I don't know if anyone wants to share a response to that.
Well, there are different things happening in different states, yes, and they are doing lots of revisions to laws. And I think that what they are doing is shifting the whole culture around thinking in a lot of different states. But there are definitely requirements in each state that you have to familiarize yourself with. Each state is different in terms of their reporting requirements and even the people that are responsible for doing the reporting in each of the states. So that would be something you would want to go back and take a look at your own laws. But again, we are happy through the Birth Parent National Network, the parents, and all of us who have worked on this publication at the Alliance to talk with people if they are interested in learning more around, the reporting laws and things that are happening across the country to make those kinds of changes. Great question, though.
I would just add
Right.
that several states are updating. So New York, I'll put the link in, and Pennsylvania has recently. Most are making this shift to add some information around bias so that the training does address that factor. I'll post the link to the online training from New York. It's very strong.
And I would just add that hopefully in all of these new revisions of mandated reporter training, that they are making sure that the parent voice is a part of those discussions, that they are co-facilitating these trainings and also bringing the perspective of what happens on the other side of when a report is made to Child Protective Services.
Great. Thank you all so much. This was a great presentation. I'm going to shift into sharing some updates from CSSP, and then Maureen will share from the Alliance. And if other questions come in the chat or in the Q&A while we're talking, please pop in there with responses. Just a few updates from CSSP, actually kind of a lot because there's a lot going on right now. Next week is the public launch of our Early Learning Nation Collective, and we invite you to join a webinar around this time next Thursday. I guess an hour earlier, I don't know. But that will just highlight what's going on with the Early Learning Nation Collective and what kind of opportunities there are for people to join. I have a QR code on the screen, but I will also put a link in the chat once I'm not talking. And related to that, we have an updated version of the Early Learning Community Action Guide and Assessment Tool. These are the building blocks of early learning communities that we've shared on these webinars before. They were updated with a lot of input from parents and partners and folks who had used them in some communities around the country. So look forward to being able to share that with all of you in more detail sometime soon, but you can download the guide, take a look at it, and we will have a digital version of that assessment tool coming next month as well. Also coming up just a month from now, or 6 weeks, let's say, is the Together for Families Conference. This is a virtual international conference. We are really excited to have partners from Canada, Ireland, and the US partnering to co-host this conference and put it on. There will be 4 plenary sessions. There will be over 50 interactive breakout sessions. It's going to be such great content. You will notice that phrase, narrowing the door to child welfare, shows up in one of the themes or tracks of the conference. But there's also going to be a lot of general strengthening families content, family support, integrating family voice, and leadership. So we're really excited for that conference and hope lots of you will join us. Registration is open now. Also, back in May, a lot of you joined us for the Strengthening Families mini summit. If you missed it, or if you were there and you just want to relive it, we do have videos from the main presentations of the summit are now on our YouTube channel. You can just go to CSSP's YouTube channel. They're close to the top of the list, but I will also put the links in the chat. And hope you can enjoy those to really hear Dr. Charlene Harper-Brown's presentation with those updated and expanded definitions of the protective factors, especially. The parent leader panel was also amazing. So if you missed that, I really encourage you to check it out. And we have some new tools that are available through our partners at the Hope Resource Center about supporting families through the Hope and Strengthening Families frameworks. This is really focused on families that are involved in intervening systems, but it also has a bunch of language in there about how Hope and Strengthening Families are connected. And I know many of you have been asking those questions or speaking about it yourselves. So hopefully that will be helpful, whether you're working specifically with system-involved families or not. And they just did a blog post on the Hope website about that links to all these different tools. And finally, I wanted to make sure you're all aware of the Nurture Connection website and blog posts and newsletter. The one that went out this week, I think, is really relevant to many of us. It's about the crucial role of discussing race and racism in pediatric settings to nurture connection. This early relational health work has really gotten to the heart of a lack of trust in a lot of settings where providers want to provide nurturing support to parents, and that is not always how it's perceived by the parents because of all kinds of issues in history and demeanor and all of that. So we're really starting to dig in on that in the early relational health work, and I hope you will check it out. Okay, I'm handing off to Maureen, and I will put those links in the chat.
It's the race to the end. Thank you. And thank you so much to our Alliance team. Great information. Thank you for sharing all of that. I think if I could rename the Strengthening Families Protective Factors Framework, I would call it mandated supporting, right? Because that's what it's really about. As many of you know, we have a training of trainers around the Protective Factors Framework. We have over 2,100 trainers in our network across the country. We have an upcoming training of trainers that's virtual on December 2nd through the 5th. Registration will be open soon. If you have any questions, you can email me. I will put that in the chat, or Lucretia, if you're out there, if you could put my email in the chat, that would be great. Happy to answer any questions for you. And that's it for our quick update. So thanks, Cailin, and thank you, everyone.
Thanks, Maureen, and many thanks to our presenters today, Meryl, Jim, Dee. This was great, great report on great work. And thanks to everyone who joined us. We'll see you again soon.
Thanks.